Hello and welcome to Journey of a Student Nurse. My name is Lee. Today I'm going to be doing a top 5 items that a student nurse should purchase or download prior to starting the training or whilst you're undertaking your training. Firstly, I'm going to talk about the NMC's Code of Practice. The NMC Code of Practice is the professional values of practice and behaviour for nurses and midwives. This is a fantastic resource that all nurses and midwives, both student and registered, should get their hands on prior to starting the training, as this is the behaviours that are going to be expected of you when you're out working with your patients on placement and when you eventually work within your preferred role. It's also a very useful thing for when you're undertaking your academic work as well, as there are going to be times when you're undertaking essays and reports when you will need to refer to this item. Item number 2 on my list today is I'm going to be talking about probably a smaller item, but it's probably an essential for your clinical skills as well as when you're out on placement, and that is talking about a pair of scissors. Now, there are many pairs of scissors out there on the market that you can get your hands on, and every pair of scissors is different as they undertake a specific type of job. You've got dressing scissors, you've got scissors for cutting sutures, you've got scissors to do X, Y, and Z. They can pretty much do anything. There are different types of scissors that you can get. The ones that I've got here are reusable scissors. You can also get what's called single-use scissors, and as the name suggests, they can only be used once. I would advise, before you get yourself a pair of scissors, is to look at your local infection control guidelines. Whether if you're in Scotland or Wales, look at your local NHS board guidelines. If you're in England, look at your NHS local trust, your NHS trust guidelines, as they can differ. One important point to know is always make sure if you're using reusable scissors, is always disinfect them before your shift, during your shift, and after with a Clinell wipe or some sort of disinfectant wipe, as it means that you're disinfecting, you're keeping your equipment clean. Item number 3 on this list today is good old hand cream. Now, there are many different hand creams out there on the market that you can purchase. I would recommend that you get yourself that one that works for you. Preferably, it's best to look for a hand cream which is non-perfumed, and it is designed to relieve dry and chapped hands, and ideally that is the best thing for it. Again, look at what your local policy says, as there are some recommendations of what you can get. I would recommend, and certainly in the NHS board that I train in at the moment, the guidelines are is that you have your own hand cream and you don't share it with other people. So I tend to carry my own one and I use that for myself. For me at the moment, when I'm out on placement, I tend to keep it in my rucksack, and it's there if I need it. Item number 4 is probably a very important one, and that is the good old nurse's fob watch. Fob watches are an absolute godsend when it comes to placement, and especially when you're working on the wards, when you're taking patients' observations, as it means then you're able to count the time, know what time it is, but also you're then able to count for a minute, to take a pulse rate for a minute and take a respiratory rate as well, and it makes it a lot easier if you can't see a clock anywhere. I would recommend that you get yourself a gel fob watch like this one, as most infection control guidelines do state in their policies that you need something which is easily cleaned. If you've got a metal one, they can actually be much harder to clean, especially if they've got grooves in them, or if they've got we have attachment points for anything. So having a single unit like that's easy to clean is very useful. So item number 5 is kind of a slight optional extra on the list. However, I still think it's quite an important one to have during your training, especially when you're undertaking your clinical skill sessions, and that is a good old stethoscope. This is very useful, especially in your early years of training when you're being taught how to do things like manual blood pressures. It's very good for you to purchase a stethoscope like this, as well as getting yourself a sphygmomanometer. And I find it's been very useful for me to practice on friends and family who are willing to let me do it on them. So blood pressure is a very important skill to learn as a nurse, and it's one of our core skills that you need to be able to do. And in order to get better at the skill, you need to practice it. And it's something that I would recommend to do, whether it's in clinical skills or at home. There are, however, different stethoscopes that you can purchase. This first one that I've got here, this is very much the low end stethoscopes, and this one I think I purchased for about £2 off Amazon, and that's bargain, and that will do the job for pretty much whatever you need to do for if you're just going to be using it very, very little and just doing it for blood pressures. If you're wanting to sort of spend a bit more on the stethoscope, you can kind of go into the sort of 10, 20, 30, 40, 50, 60, 70, 80, 90 and then £100 ranges, and go into the sort of mid-hundreds for some stethoscopes, which is quite a lot. The one that I've got here is the Lippmann Classic 3, and this is what I would consider a sort of mid-grade stethoscope, somewhere in the middle. And I find the Classic 3 works really well for me. Compared to my cheaper one, the tubing is much more robust, the earpieces are much more comfortable, as well as the belt and the diaphragm are much more durable, and they are going to last longer. And again, depending on where you're maybe looking to end up with your career, it may be worth wanting to invest in at them early on in your career. However, it's not an essential item. When I was out on my community nurse placement, I really used my stethoscope quite a lot when I was in patients' homes, because I was doing a lot of manual blood pressures, and I found having one that worked much better, having a more reliable one when compared to working with the cheaper one, worked quite well for me, as it meant that I knew what sounds I was listening to was accurate. Secondly, on this list, I'm going to throw in a few optional extras that you may wish to purchase. The first one is getting yourself a retractable ID badge holder. These are an absolute fantastic investment, and I couldn't recommend them enough. Most doors nowadays require you to swipe your ID badge in order to get access to certain areas. So having one which has got a extendable lanyard means you don't have to unclip your ID badge and then swipe it on the door. Means you can then just pull your ID badge literally and just scan it against the door, and it will let you into the area that you're intending to go to. The next item I would recommend is getting yourself a good nursing textbook. For me, I've chosen the Royal Marsden Clinical Nursing Procedures, and I have to say this is a fantastic resource, and this has everything you need to know about nursing practice. The edition that I've got is the student edition, which is the 9th edition of this particular book, and it covers absolutely everything from discharge planning, basics of both written and verbal communication, infection control, clinical skills such as your blood pressure, both manual and automatic, knowing how to work within an operating theatre, and many other things in between. It's a very, very useful resource. And finally, I would recommend that you get yourself a notepad as well. I would recommend one which is quite slimline, like this one here, and one that could maybe fit in a pocket. Maybe you can get ones that are smaller than this. And these things are very useful, especially when you're out on clinical placement, and if you needed to jot something down, you can have somewhere you can go write it down quite quickly, take notes on something. For example, If you were out visiting a patient at home, or you're on the ward and you saw the nurse or the doctor breaking bad news, you may want to reflect on that, and having something that you can have quick access to means you can write your immediate thoughts down following the event, and it means it's in a place where you can then later go back and say, actually, I found this is what was said in the conversation, this is what the doctor said, this is what the doctor did, this is how we as the nurses followed up with the patient, and it's good for the reflective practice. And on that note, reflective practice as a nurse is a key component of our revalidation in our nursing careers, and it's very good from the day one of your nurse training to get into the habit of becoming a reflective practitioner. So just to conclude this video, I would encourage you to go have a look at these items that I've talked about today. It's not set in stone. You don't need to go and say, hey, I'm going to go buy everything on this list that Lee has said. This is what my opinion of what I think are some of the top 5 nursing items, with a couple of additional extras as well. There are many items out there that you may wish to purchase as a student nurse or as a registered nurse, and there are items that are not so essential. So again, do your research on the items. And I would just like to finish off by saying thank you for tuning into this video today, and I really hope that you have found this useful. If you're just to stay tuned for more great content in the coming weeks and months, just like and subscribe below and hit the bell as well, just to have for notifications of when a new video pops up. It is great that when you tune in, and it shows support for the channel, and I'm hoping to continue to grow it in the coming months. So that's all from us at Journey of a Student Nurse. All the best with your training for now, and good luck.